today we will quickly see the important questions related to the tibia. So first of all, site determination of tibia. So as we all know, tibia, it is medially placed bone in the leg. Now it has two ends, upper end and the lower end. So first identify the lower end. We have a bony projection at the lower end, which is known as the medial malleolus. So it will help you to determine the medial side as well as the lower end of the tibia. And anteriorly at the upper end, we have the tibial tuberosity. So this tibial tuberosity, it is placed anteriorly and it determines the upper end as well. So it will help you to identify the site of the tibia. Another important feature, it is this anterior border, which is a sharp border, and it is known as the shin of tibia. And on the posterior surface there is an oblique line which is known as the Solian line. Name the bones articulate with the tibia. So at the upper end, tibial condyles, it articulates with the femoral condyles and form the knee joint, which is condylar variety of joint. Posterolaterally, there is a facet for the fibular head and it forms the superior tibiofibular joint, which is plain variety of synovial joint. Middle, there is an interosseous membrane, so it forms the middle tibiofibular joint and it is fibrous variety of joint. Inferiorly, there is an articulation between the tibia and fibula and forms the inferior tibiofibular joint, which is syndesmosis variety of joint. At the lower end of tibia, it articulates with the talus bone along with the medial malleolus and it forms the ankle joint, which is modified hinge variety of joint. Draw the capsule of knee joint. So capsule of knee joint, it is attached at the peripheral margin of the articular surface, but here there are two variations. So first, on the anterior surface, this capsule, it is extended up to the tibial tuberosity, and on the posterior surface there is a gap in the capsule and this gap is for the tendon of the popliteus. Now what are the attachments on the superior surface of condyles of tibia? So peripheral margin of condyles of tibia, it provides attachment. They are articular and they provide attachment to the medial meniscus and the lateral meniscus, and the central area, that is known as the intercondylar area. So this intercondylar area, it gives attachment from anterior to posterior. It gives attachment to the anterior horn of medial meniscus, then anterior cruciate ligament, anterior horn of lateral meniscus, then posterior horn of lateral meniscus, then the posterior horn of medial meniscus and the posterior cruciate ligament. So you can remember it easily as the Medical College of Lucknow to Lucknow Medical College. Now, which are the important attachments on the upper end of tibia? So posterior surface of medial condyle of tibia, there is a principal insertion of the semimembranosus muscle, and anteriorly on the tibial tuberosity there is an attachment of the ligamentum patelli. Attachments on the medial surface of tibia. So this is the medial surface of tibia. Medial surface of tibia, it is entirely subcutaneous except the upper 1/3 part. So at the upper 1/3 part there is an insertion of the three muscles. So from before backward, the first one, it is the hockeystick insertion of the sartorius muscle, and just behind it there is a linear insertion of the gracilis muscle and the semitendinosus muscle. Otherwise the entire surface, it is subcutaneous. Then important relationship at the of the lower part of the medial surface of tibia. So it is crossed by the two important structures. These are the great saphenous vein and the saphenous nerve. Now sartorius, gracilis and semitendinosus, these three muscles, they are from the three different compartments and they form the gyrobes. So what is the functional importance of gyrobes here? So by the combined actions of these three muscles, they acting from the tibia and stabilize the bony pelvis. Attachment on the lateral surface of tibia. So lateral surface of tibia, there is an attachment of the tibialis anterior muscle. Enumerate the structures crossing the anterior surface of lower end of tibia. So from medial to lateral side, the hospitals are never dirty places. So this is from medial to lateral side. T stands for the tibialis anterior. Then this one is the extensor compartment. So extensor hallucis longus. Then artery, it is the tibial, anterior tibial artery. Then deep peroneal nerve. Then extensor digitorum longus and the peroneus tertius. So these are the structures which crosses it from medial to lateral side. Important attachments on the posterior surface of tibia. So on the posterior surface of tibia, we have a soleus line. So this soleus line, it gives attachment to the soleus muscle and the fascia covering the popliteus muscle. Then this posterior surface, it is divided by a vertical ridge into two areas. So medial area, it provides attachment to the flexor digitorum longus, and lateral area provides attachment to the tibialis posterior. Just above the soleal line there is a triangular area, and this triangular area, it provides insertion to the popliteus muscle. Enumerate the structures crossing the posterior surface of lower end of tibia. So from medial to lateral side, the doctors are never hungry. So here this is the posterior compartment, so it is the flexor compartment. So tibialis posterior, then flexor digitorum longus, then posterior tibial artery, tibial nerve, and the flexor hallucis longus. So these are the structures. Now, which ligament is attached at the tip of the medial malleolus? At the tip of the medial malleolus, there is an attachment of deltoid ligament. This structure lies in the groove on the posterior surface of both the condyles. So this one is the medial condyle. So at the medial condyle, in the groove, here we have an insertion of the semimembranosus muscle, and this is the lateral condyle. So at the lateral condyle posterior surface, there is a gap for the popliteus tendon. So this groove, it is occupied by the popliteus tendon. Now, importance of tibial tuberosity. So here this is the tibial tuberosity. Tibial tuberosity, it has two parts. Upper part, it is the smooth, and lower part, it is rough. So smooth part, it gives attachment to the ligamentum patelli, and rough part, it is related with the bursa. Now this is an important surface landmark, and this broken line, it is the epiphyseal line. So this epiphyseal line, it passes between this smooth part and the rough part of tibial tuberosity. Now, what is the characteristic of nutrient artery of tibia? So nutrient artery to the tibia, it is the largest nutrient artery in the body, and it is a branch of the posterior tibial artery. Which is the commonest site of fracture of tibia? So commonest site of fracture of tibia, it is the junction of the upper 2/3 and the lower 1/3. Now at this part tibia, it is more slender. And what is the complication of this fracture? So delayed union, it is the one of the complications of this fracture because of the poor blood supply. And the commonest site of osteomyelitis, it is the upper end of the tibia.